Welcome to our lecture on adenoids. Today we will explore the anatomy, function, clinical significance, and management of adenoids, also known as the pharyngeal tonsils. I am Kuya B, and I am pleased to guide you through this important topic. During a board exam in general anatomy, you might encounter a question like this. Which structures are called adenoids when enlarged? A. Lingual tonsils. B. Palatine tonsils. C. Pharyngeal tonsils. D. Waldeyer's ring. Don't panic. Let's break down the options and find the answer. First, lingual tonsils. These are located at the base of the tongue and are not referred to as adenoids. Second, palatine tonsils. These are located at the back of the throat, also known as the tonsils, but not as adenoids. Third, pharyngeal tonsils. These are the correct answer. Pharyngeal tonsils, also known as adenoids, are located in the nasopharynx. We have Waldeyer's ring. This term refers to a ring of lymphoid tissue that includes the palatine tonsils, lingual tonsils, tubal tonsils, and pharyngeal tonsils, adenoids. However, when specifically referring to adenoids, we mean the pharyngeal tonsils. Adenoids are most prominent in children and tend to regress with age. They typically reach their peak size between ages 3 and 5 years. This is why enlarged adenoids are more commonly a pediatric concern. The primary role of adenoids is to act as the first line of defense against inhaled or ingested pathogens. They contain lymphocytes, which are crucial for producing antibodies. This function helps protect the body from infections. Adenoids work in collaboration with other components of Waldeyer's ring to protect the respiratory and digestive tracts. This integrated defense system helps to trap and neutralize pathogens before they can cause harm. Enlarged adenoids can cause several symptoms, including nasal obstruction, difficulty breathing through the nose, mouth breathing, snoring, and in severe cases, sleep apnea. They can also lead to recurrent ear infections due to the obstruction of the eustachian tube and chronic sinusitis from blocked nasal passages. Management of enlarged adenoids often starts with medical approaches. Observation is appropriate for mild cases that may resolve on their own. Nasal corticosteroids can be used to reduce inflammation, and antibiotics may be prescribed for associated bacterial infections. For more persistent or severe cases, surgical management may be necessary. Adenoidectomy, or the removal of the adenoids, is indicated for persistent symptoms, recurrent infections, and sleep apnea. The procedure is usually performed under general anesthesia, often on an outpatient basis. Post-operative care includes pain management and monitoring for complications such as bleeding or infection. In conclusion, are a critical part of the immune system, but can cause significant symptoms when enlarged. Appropriate diagnosis and management are essential to improve the quality of life for affected individuals. Thank you for your attention, and I encourage any questions or discussion on this topic. I now open the floor for any questions or comments. Please feel free to share your experiences.